So you just had a baby and feel restless, anxious, or depressed? Find out what you need to know about postpartum depression, a common condition that often goes undiagnosed and takes the joy out of childbirth. Next on Living Smart.
Production funding for Living Smart with Patricia Gras is underwritten in part by Halliburton.
Hello, I'm Patricia Gras. Welcome to Living Smart, the show designed to help you get the most out of life. Why is it that women suffer from depression twice as much as men? What's normal when you've got the blues, and when do you have to seek help? Our guest, Laurel Spence, will share with us what she's learned about depression in women from a professional and a personal experience.
What do you like to play on the computer?
Emma.
Hello game. What does Emma like to sing?
Laurel
Okay.
and Jim Spence enjoy being parents to 3 girls. College sweethearts, they always dreamed of having a family. But little did they know a quiet intruder would steal some of the pleasure that comes from the birth of a child.
When you're expecting your first child, you know, there's a lot of joy surrounding that whole experience, and you know, none of that, you know, was ever compromised in any way. There was still a lot of joy surrounding that experience, but just the sleep deprivation and the I guess hormonal changes that my wife's body went through upon delivery of our first child were pretty substantial, and I think we had both underestimated the effect that would have on her.
They both felt they were in a roller coaster ride until they realized postpartum depression was the culprit. Physically, Laurel lost weight very rapidly. Mentally, she felt something was really wrong.
I just wasn't able to cope anymore. Another huge symptom that I had was a lot of guilt. I always felt like I should be somewhere other than where I was. So it was like I was never relaxed, never comfortable. Even if I was doing something to care for my baby or my family or my patients at work, I was always distracted.
This was quite unusual for Laurel, top of her class in college and always the academic overachiever.
Do you see this result here?
Mm-hmm.
A physician's assistant, she had enjoyed the obstetrics and gynecology rotation more than any other.
It is amazing in retrospect to realize that I had all the book knowledge, all the head knowledge, maybe not as much experience at that time because I was a very new graduate when I had the baby. One of the big problems with your first baby is that you have no idea what to expect. I wasn't prepared for how completely exhausted I would be.
Yet she didn't take any medication or get help until the birth of her second baby.
At that point, the media had been talking a lot more about postpartum issues. I had educated myself a lot more about it and talked to some friends who had just depression in general. I knew the statistic that 50% of the time, once you have an episode of postpartum depression, that you have a recurrence. But it still was up to me to ask for help, which has always been a problem for me anyway, depressed or not, asking for somebody to help me.
A common problem with new moms.
How were you feeling? Did you feel...
That was a tough adjustment.
Today, she monitors her patients, coaches them on this type of depression, and shares her own symptoms.
I would just be very irritated inside and have trouble kind of dealing with people. And normally I'm a very relational person, and so that was unusual for me. I didn't even want people to come to my house and see the baby.
After getting the right medication and therapy, Laurel became an advocate for women who suffer from postpartum depression. 1 out of 10 pregnant women suffer from postpartum depression, often undiagnosed. Many never know what hit them and suffered needlessly.
The worst part was the isolation, which doesn't really make a lot of sense when you have a baby and lots of people around you, but you feel like no one really understands you, and you're not... I think I did know I wasn't normal even when I wasn't diagnosed, because I knew I didn't feel like myself. But I didn't know how to get out of it or what to do.
Both Jim and Laurel have learned the importance of getting the right help.
Parenting is not for the faint of heart, and I really stick to that adage a lot, that parenting really is difficult, but I think the the best advice I have to give anybody is just try to stay as in tune and engaged with your partner as you possibly can.
Thank you so much, Laura, for joining us.
Thank you,
We
Patty.
appreciate it. Now, is postpartum depression something that it's kind of like a new concept, or we're hearing more about it, or is it something that has been out there for a long, long time and we just didn't recognize it?
Excellent question. We're definitely hearing more about it. Some of that results from some of the extreme cases, the tragedy that can result due to hormonal changes after delivery and moms not transitioning well during that time. I also think that in our society in general, at least in the United States, we are raised as women to be very independent and to not need the help of others. In other cultures around the world, some cultures bring other women together
to help out
for a whole month to take care of mom and baby. And mainly, they take care of the baby while mom recuperates. We don't do so much of that here in the U.S. unless you pay for a service.
Right. Now, let's talk about taking medication during pregnancy. It's kind of a controversial issue. What do you know about that, taking medication during pregnancy for postpartum depression?
Yes. Taking medication during pregnancy and even breastfeeding are controversial for many people. Some of that is truth, and some of that is myth. Mm-hmm. Truly, during pregnancy, if you are depressed, taking medication is transferred through the placenta to the baby, but it's in such a small amount, and also depending upon the actual medications that you're taking. The downside of not taking medication during pregnancy while you are depressed can lead to long-term effects on the baby.
So either way, there's pros and cons. It's something that you should discuss with your doctor.
Exactly. All of medicine is weighing the pros and cons.
Okay, now let's talk about baby blues and postpartum depression.
Sure.
According to the medical journals, baby blues tends to be the normal thing to go through after because of the hormonal changes.
Right.
But explain to me the difference between both of them, because one is more serious than the other.
Exactly. Baby blues, we think, occurs in about 80% of moms. It's during the first 2 weeks after delivery of the baby. That's key. Any symptoms that last past 2 weeks, then we need to be looking at depression. Baby blues tends to be, you're just crying more easily, you're very tired, you are able to still express the range of emotion from happiness to sadness to being excited to being frustrated. That's all a part of the first 2 weeks. And lack of sleep doesn't help anybody.
Right.
Hormones during pregnancy are at the highest they ever are in a woman's life. And within 24 to 48 hours after delivery, there's a precipitous drop, a huge drop in the hormone to even lower the normal levels. Some of that is because hormone was made by the placenta, and now that's gone. And so baby blues tends to be a, quote, normal reaction to that drop in hormones.
What about symptoms of postpartum depression, which is not normal?
Right. Postpartum depression is beyond 2 weeks postpartum and can extend out to a year and a half if it's not treated. Basically, postpartum depression tends to be highlighted with anxiety, guilt, irritability, feeling overwhelmed, and typically the mom has a lack of appetite, has trouble sleeping.
Give me examples of what happened to you.
Sure. After my first baby, I got her home and I was determined to be the best breastfeeder ever. And so even while I was in the hospital, I put her to the breast to feed about every hour and a half. And that was initially so my milk would come in. Then after that, the baby was very fussy, and that's when she seemed to want to eat. Well, you can imagine after days of not sleeping, anybody has trouble. But the trouble didn't seem to go away after I did start sleeping a little bit more and got more into routine with the baby. I didn't enjoy friends calling or coming over. I saw that really as an intrusion, and that's very unusual for me because I am a very social person in general.
It really changed your personality.
It did. I think it was mainly because I just didn't feel like I could deal with anything more than my little world of my baby and my husband and myself.
Now, let's talk about what's unique about the female brain and depression.
We used to think, in general, that women were little men. And we're finding out more and more as more studies are being done on females that that is absolutely not true. The hormones that change throughout the female's lifetime are dramatic shifts, even during the month when you're having hormonal shifts to then have a menstrual cycle. There are dramatic shifts in hormones. So that by itself can change the woman's brain and how the woman is able to cope and deal with different situations that occur in her normal daily life.
Talk about this, the cycle, the life cycle of women and depression and hormones, because there's obviously a connection.
Yes, there is. What's interesting is that across the world, you seem to have more women depressed than men. So it doesn't seem to be cultural or related to just one particular geographical location. And about, like you had mentioned, 2 times as many women are depressed than men. That has been seen in a study with 38,000 women across 10 countries. And basically the life cycle, what they did was they asked women who reported depression the age of their onset of their depression. So when they looked across the board, they looked at men and women, I should say, in these countries and asked the age of onset of their depression. About age 14, you see this dramatic differentiation between men and women that stays different until the menopause, basically. Yes, some women can become depressed at menopause because of the hormonal changes there, but in general, this 2-to-1 ratio is stable across the life cycle for women, that being the time that women are influenced by hormones the most.
What tends to happen to women and the family dynamic when they're depressed?
It can be very difficult because, as you know, a lot of times the woman and the mom is what helps stabilize the family. It tends to take care of everyone else. Not to diminish dads, they have a huge role in taking care of the family, but when one parent isn't functioning to their best level of capacity, then the family suffers. And beyond that, I would dare to say that society suffers because the woman isn't able to provide her unique gift to society and to her family and nurturing her family.
For you, what was the hardest part of dealing with postpartum depression?
I think the hardest part is this kind of relational distance that was self-imposed, but I didn't really understand why. After my first baby, I did not have postpartum depression diagnosed because I never sought help. In retrospect, I realized that's what it was. And so after my second and third child, I did get help. And it just, the relationships with my children, with my husband, and even with friends and other family, I think suffered because of the experience that I had and the trouble I had coping with life.
Is there a difference between postpartum depression in women and just general depression in women? Can you actually tell the difference?
There's a difference in the fact that it surrounds a significant life change, both a physical change and a hormonal change, and then just even a change in your daily routine, obviously. The symptoms of depression in the postpartum phase does tend to have more of an irritability and lack of appetite and guilt, although some of those can be symptoms of depression in general. Depressed women and men may eat more than eat less.
Right.
Guilt certainly can be a component. The depressed mood is a component in general for major depressive disorder, but postpartum, it tends to exist as more of an irritability or an anxiety in addition to perhaps a depressed mood. If you talk to these women, they don't necessarily feel sad. They feel overwhelmed and frustrated,
Right.
not knowing what to do.
What is the difference between depression, let's say, and being sad or or grieving for a good reason?
Right.
I mean, what's normal and what's abnormal, really, is what I'm asking when you're depressed,
Exactly.
when you're sad.
Exactly. We use the word depression a lot in our society. I feel depressed.
Right.
And maybe we just mean I feel sad today. And certainly in grieving, it is completely normal to grieve when you lose someone and for that to last quite a while. And the grief cycle shows us that you go through a cycle and you may go through it again and again, from denial to then acceptance.
Right.
That cycle involves sadness, surely. It involves tears. It involves questioning. It becomes pathological when you, with grieving, after a defined period of time, aren't able to function.
Okay.
If you think back to when you lost someone dear to you, you perhaps couldn't function for a period of time, because it just felt like the whole world had all of a sudden changed.
Right.
But then slowly you
come out of it.
Exactly. Depression, typically you don't just get over it. With postpartum depression, we think that the hormones stabilize to a point where the woman is able to do well. And this happens in women that have never had a history of depression before.
Right.
That was the case with me, or at least I had never recognized that I had a history of depression personally before this happened. And the theory is that some women are more susceptible to changes in hormones,
Than
basically.
If you suffer from depression, you get a diagnosis, how safe are the medications, and is that enough?
Medication is certainly a part of it. I like to think of it as medical intervention, therapeutic intervention, or psychology or psychiatry, which can also do the medical, and your support system,
Right.
which would be who you surround yourself with, who helps you in your day-to-day life. So medicines are much safer now than they used to be. The medicines that used to be prescribed mainly for depression had a lot of undesirable side effects.
Right.
Today, there's a class of medications called the SSRIs, or the selective serotonin reuptake inhibitors. Basically, that just keeps serotonin, a neurochemical in your brain, at a higher level than normal. And serotonin at a certain level is important to keep your mood stabilized.
Let's talk about what happens to people who don't want to ask for help. You know, they're kind of sad, and they've been sad for a long, long, long time, probably clinically depressed, but they don't want to go out there and let anybody know.
Right. Two things. One, we're again, as a society, independent. We like to pull ourselves up by our bootstraps and keep going. We traditionally don't like to ask for help because we don't want to appear weak. The other side of that is that when you are depressed, do you realize it? Sometimes no, you don't. Sometimes you don't have what's called insight into yourself, into your own thoughts, into your own emotions or the meaning of those. So your insight is skewed, or your ability to understand what's objectively, or to have some objectivity, is skewed. So it's very difficult sometimes to know what's going on. It may manifest itself in physical symptoms, which is why healthcare providers really need to be looking for depression in their patients.
I was going to ask you about physical symptoms. Most people don't see depression as something that causes you pain, for example, muscle pain or other type of physical ailments. How tied are these physical ailments or problems with depression?
I think in traditional medicine, we're pretty good at addressing physical complaints. And some practitioners are very, very good at addressing mental health complaints, but it tends to take more time. If we can see what's broken over here and fix it, this is a little bit more muddy water in general. That's completely a generality. The physical complaints or manifestations of depression can certainly be many. It Stress, as we know, affects our body in many, many ways. So undiagnosed, untreated depression elevates our stress hormone cortisol. And we have more of a stress reaction in our body. We can have stomach problems. We can have menstrual cycle changes if we're women. We can certainly have excessive fatigue and muscle pain, headaches, these types of things.
Is it unusual to find people who suffer from depression for a long time and don't even know it?
It's not unusual because that becomes your baseline.
What do you mean?
That's what you think is normal for you. So perhaps when you do feel a little bit more up or something happens that excites you, maybe you're not able to express the full range of your emotions. You're kind of blunted. And so when it's undiagnosed for a long period of time, that's just what you see as normal.
What if you know someone who you love who has depression and you tell them, but how do you handle something like that?
Mm-hmm. Friends and family are key, instrumental. I think a lot of times as friends and as family members, we're afraid of depression. We're afraid. We definitely don't want to label people. We want to help people. So when we see a problem developing in our friends and family that we think might be the symptoms of depression, the best thing we can do is encourage them to visit someone who can help them and help them figure out what's going on. One thing you can do is to just say something non-threatening, like, I notice you're really having a lot of trouble in whatever particular area you're addressing with them. How do you think we could get some help for that? And sometimes if you just introduce the issue of depression in a non-threatening way, then that helps the patient. You may even offer to take a family member to a healthcare provider that you know.
Like, give me an idea of how would you do that?
For example, if my mom was having trouble,
right.
I might say, Mom, I'm really concerned about you, and I'm concerned about you because you don't seem to want to do the things you used to like to do, and why is that? And then listen to her reasons, and then suggest that perhaps there's another reason. Perhaps she needs some help to get her body back the way it used to be, a little more regulated, a little more regular. And I could say, Mom, I know this physician or physician assistant who's very good at helping you figure out what's a physical problem and what's a mental problem, and they're both equally important. So if I make you an appointment, will you come with me? I'll take you.
What is the biggest myth about depression?
I think one huge myth is that it's a character flaw, it's a weakness, and also that you can just pull yourself out of it. Sometimes you can't. I would say the majority of the time you can't. Sadness, grief, yes, you can. But if we're really talking about a chemical process, almost the same as a person having diabetes, a problem with their pancreas, versus someone not making the chemicals that they need in their brain to function well, that's similar. So certainly it's an issue that needs to be dealt with, and it can be a chronic issue.
A quick explanation of what's the difference between postpartum depression and postpartum psychosis.
Oh,
which is
yes.
very unusual.
Yes. Postpartum psychosis has gotten a lot of press, especially in Houston with Andrea Yates. Yes. Andrea Yates definitely had postpartum psychosis. It's different. It happens in less than 1% of postpartum women. So during the postpartum period of that 1 year out to perhaps a year and a half, these women experience delusions, which means they hear things, they see things that aren't there. They also may have hallucinations, which are seeing and hearing things that aren't there, and delusions, believing something that isn't true. So it's very difficult for us in general to understand how that can be.
Right.
But that is an emergency. It's a medical emergency. Usually these people have a history of depression in the past or perhaps psychosis, and their symptoms may show up while they're still in the hospital, day 2, day 3 postpartum.
I know that you're living smart because you chose to get help. Even after the first one that you didn't get help, but you did get help for the second one and the third one, and you're doing very well. And I thank you for coming over here and sharing your story.
My pleasure.
There's a lot of women out there who are suffering, and they shouldn't be. Thank you so much for joining us.
Thank you.
And you can learn more about Laurel Spence by going to our website, houstonpbs.org/livingsmart. There you'll also find a complete resource list. And feel free to share your own views on coping with depression and postpartum depression. You can call us with your comments at 713-743-8513 or email livingsmart@houstonpbs.org. And that's our show for today. I hope you've enjoyed it. Remember to live smart. I'm Patricia Gras. Have a grand week.
Production funding for Living Smart with Patricia Gras is underwritten in part by Halliburton. For a transcript of this program, send $6.95 to the address on your screen. Please include the name of the guest.